Europe is that the two biggest scandals in Greece.
First of all, I want to stress that the policies that are now implemented in Greece are exactly the same policies of the IMF, that the IMF introduced and destroyed Africa and Latin America 20 years ago. So they are exactly the same. Structural adjustment and cost containment and destroy of every public sector and even the public idea, the idea of the public sector.
A lot of people without treatment because they needed cancer.
In terms of social determinants, we have thousands of people that are getting impoverished in a very short period. And this is driving, first of all, to a lot of psychiatric morbidity. We have the suicide rates are raised very importantly and severely, and all kind of psychiatric crises, depression and so on. And on the other side, where we have this increased needs of the population for more care and more specialist care, the government is closing down the public sector, closing down hospitals, general practices and so on, and we have a growing, very fastly growing private sector, which is, of course, asking for money. So this is an impasse for the health crisis today in Greece is very important. And we are speaking about a humanistic crisis that is coming on if these policies are not stopped and new measures, new policies are not implemented immediately.
Towards eliminating those.
In Egypt during the past decade, we witnessed growing inequalities in health, and I think that these inequities are related to structural determinants, starting from the structural adjustment program, which was imposed by the monetary organizations like the IMF and World Bank, and as it happened in many other developing countries, it has a negative impact on the social protection in Egypt and of course on the health status. And this process led to a massive wave of privatization, and the privatization lately reached the health sector and education, and the privatization led to more inequalities. Since the revolution, the interest of the society as a whole was moved towards pushing into political democracy, democratic process in electing the parliament and the government, the presidency, and so on. So these issues related to education and health in particular, which I feel they are very, very important, they were not addressed properly. In addition to that, having the Muslim Brothers and the authority elected for the presidency, we feel that they are more neoliberal than the old regime. So they will work for the market economy. However, to continue winning votes and more grounds, they may impose some social services and things like that to make people feel that they are working for them, which is, I think, on the long run, it will not be true.
In 1971, I was a vascular surgeon working in England. Then East Pakistan, which is today Bangladesh, we fought for our independence against Pakistan. Myself and a friend, Dr. Mobin, came out of England to fight in the guerrilla warfare, but also they need a doctor. So later on, we built up hospital, but in the hospital there is no like a helping hands, no nurse, nothing at all. So we have to innovate young women as a nurse, and within a very short training they learn very fast. So that gave us an idea, the health care needs to be demystified. So after the independence in 72, in Savar, we built up slowly and with involving the community, community provided us the land, they provided us labor, and then really we also really talk with them for various meetings. That is the way we pick up the idea of Ganushastra Kendra. Ganushastra Kendra meaning is the people's health. Along the GKs, our few things, like in maternal mortality, we have reduced, infant mortality reduced, and at a very low cost. Another big achievement of Ganushastra Kendra, GK, was that fight against the multinationals. We say drug price is too high. Multinational companies are pushing wrong drugs and very costly drugs, and they are making too much of profit. So by 1982, we could convince the government to have a national drug policy. As a result, what happened? We are one of the 49, one of the least developed countries, but we are one country among the least. We produced 97% of our drug necessity are produced, manufactured in Bangladesh. Second achievement of Ganushastra Kendra is the women's development. And GK has trained women in every branch you name: driver, electrician, boiler operator. So all sorts of branches, so they are equally with men. So I think this is our achievement of GK, and also led to a national women's policy. We played a very important role.
Very privileged to have the Global Assembly here. Of course, it's also been a lot of work for a lot of people, and there have been some anxieties about having it, but I think that all in all it's tremendously exciting, and it's a tremendous boost for PHM South Africa, and I hope that we will use it to launch a more revitalized and exciting movement within our country.
I think there are two general important things. The first is the ability of this People's Health Assembly to draw attention of the world to some of the key things that we have been struggling with in our various places of work. Secondly, and perhaps more importantly, for this global solidarity of people coming together, I think it has the importance of letting each one of us see the commonalities of our struggles, that the fight that we are struggling with in Ghana for better healthcare is tied up and similar to struggles in Thailand, in India, in Brazil, and all over other places. Therefore, it serves us, it gives us a lot of energy and momentum when we come together and discuss these common issues, so that when we go back home, we go back with fresh aspirations, with fresh hope, and with fresh energy to tackle the issues.
I think for me personally, it's about being inspired and about getting a sense of what we need to do next. And I think for the movement, it's about increasing our sense of solidarity, and we're developing a Cape Town call to action that will actually lay out a blueprint of what the People's Health Movement will do over the coming years leading up to the 4th People's Health Assembly. So we're going to work out what are the key points of action, and also develop in more detail what our vision of an alternative world is, and an alternative world that enables people to lead flourishing lives and people to lead healthy lives, and for us to have a sustainable planet.